Acha, meningomyelocele I told you, which is also known as spina bifida occulta, which is the most commonest location for a neural tube defect, is an exam question. So lumbosacral region, the most common location for a neural tube defect is lumbosacral region. That part is done, and yeah, everything we know. Acha, contents of meningocele. Quickly, if I ask you, contents of meningocele, not myelomeningocele. See, myelo means myelin sheath. Myelo will have a spinal cord or a continuation known as cauda equina. Okay. So, and brain matter also is nowhere included here. So, meningocele will have a dura matter, arachnoid matter, or pia matter. That is why A becomes the best answer. Next question: which sign do you see in spina bifida? In the neural tube defect, basically banana sign and lemon sign. Banana sign and lemon sign, just two names you should know. Banana sign and lemon sign you see in the case of spina bifida. Remember that. Okay, this is the banana sign. Okay. Number two, how do you refer this patient? This is a good question. Like if this patient, this ruptured meningomyelocele or meningomyelocele patient is there, if I have to refer this patient, how will I refer it? You can't just keep the defect open. You take a normal saline and you take a gauze piece. You take a normal saline, you take a gauze piece, and you basically wet the gauze piece with normal saline. You soak the gauze piece with the normal saline, and that's how you refer the patient. Remember that. So this was the AIMS question. The case of meningomyelocele was posted for surgery. Till the patient is waiting, the covering of the sac must be protected by what? It is protected by the gauze soaked in normal saline. Remember that. That you should know. Next question. This was same swelling which I was talking previously also. It's a case of encephalocele. It's a case of encephalocele. Remember that. Okay. So this part is done. This part is done. Now this is a very important exam question. Let me see if I have the video of this one. So this is my first day posting in the Hindura hospital when I was doing my SRship. So if you can look at this baby carefully, yeah, by front this baby looks like a case of Anencephaly. I agree with you. But if you rotate the baby, so this is a classical where the brain and the spinal cord is fully exposed. Where the brain and the spinal cord is fully exposed. Now, what do you call this condition? This is an exam question, came in the FMGE exam also. Craniorachis. Craniorachis. The neural tube defect with the worst prognosis. The neural tube defect with the worst prognosis is craniorachis. It's an exam question, star mark. The neural tube defect with the best prognosis is spina bifida occulta. The neural tube defect with the best prognosis is spina bifida occulta, and neural tube defect with the worst prognosis is craniorachis. An exam question, this one, craniorachis. So this is a classical case of craniorachis, an exam question. This is a flat head. Now, only flat head or an absent calvarium, absent scalp, you will think of Enencephaly. This is Enencephaly. This also head is not there, Enencephaly. This also head is not there, Enencephaly. I wish this baby comes in your dreams tonight. So that's what. Retroflexion of the head. When the head is totally retroflexed. Now, what do you call this condition? Now, this condition is known as Iniencephaly. This condition is known as Iniencephaly. Retroflexion of the head, image-based question, Iniencephaly. Remember that.